business people who would dearly love to get their people, their employees, health insurance, but they can't afford it. The number one reason, if you look at North Dakota's report on premiums, it is by and far the number one reason why employers do not cover employees is because of cost. We are going to make, this bill is going to make that benefit affordable for those small business people. And so I want, on behalf of those small business people, to thank Senator Conrad. Can we thank Senator Conrad? Young people, ages 22 to 26, who are going without any form of health insurance and hoping upon hope that they will not have any injury or, God forbid, suffer a pre-existing condition during that time period without health insurance. Let's thank Senator Dorgan on behalf of been able to afford health insurance, who have been simply betting the farm, literally betting the farm, that they wouldn't get sick, and now will find health care affordable, insurance affordable for them. Can we thank Senator Dorgan? Who have lost their jobs and can't get on health insurance because of pre-existing conditions, let's thank Congressman Pomeroy for that. Let's thank Senator Conrad on behalf of all the seniors who no longer will worry about affording their prescription drugs because the donut hole has been plugged. Wages in North Dakota aren't what they could be, and they certainly aren't what they are regionally. And one of the pressures on wages has been health insurance costs, where the costs have risen way beyond inflation in other areas, cutting into our salaries on behalf of all those workers who could use a raise and quality, affordable health care. The help is on the way. Let's thank Representative Pomeroy. Now, I don't know how many of you know this, but when you go out and look at the studies of the number of private employers, people who employ people in the private sector. Okay, when you go out and look at that, how many of the top 10 do you think are healthcare workers? It's 8 out of the top 10 work in healthcare, and if you go down into 20, it remains to be almost 50% of the top private employers in our state are healthcare workers. Every one of those healthcare workers had their job threatened by unfair Medicare and Medicaid reimbursements. Reimbursements where our rates were reimbursed much less than the rates reimbursed for the same services and the same quality care in Minnesota. Every one of those workers owes a debt of gratitude to Senator Dorgan, Senator Conrad, and Congressman Pomeroy, who have gotten them the equity that they need to continue to provide quality medical services in the state of North Dakota. Let's thank them. Well, you've all heard the arguments against this bill. It's a mammoth takeover of health care by the federal government, and if we could just get the federal government out of our health care, we would just be better off, right? That's the argument, because they can't argue the particulars, because the particulars don't support the anger and the angst. So they just do the generalities. This is socialism. I was told when I was Attorney General, we were working on the smoking measure. I was told by the health officer that 70%, not 70% of all health care in North Dakota is paid for by the federal government. 70%. And you may say, how can that be? Well, let's add it up. Medicare and Medicaid, Indian Health Service, Veteran Services, federal employees. Think about it. Children's health insurance, 70%. We can only imagine what would happen to our health care and the quality of our health care here in North Dakota if we took the federal government out of health care.